what are the different factors, what are the different causes that are involved in causing stress? So, first of all, introduction is very important. What is meant by stress? Stress is basically a state of psychological and physical tension that is produced when an individual perceives that they are unable to cope with the demands imposed on them by a stressor. Any kind of psychological or physical stress, whenever we are facing in the form of psychological or physical symptoms, that in different type of situations in which we are unable to cope with different levels of stress or different levels or different demands or expectations, in which we cannot cope with that situation, that is called as stress. Now, when we say that stress is caused by different type of stressors, what is meant by stress? Stressor is something that causes a tension, right? So stressor means anything, any object, any individual or experience that causes tension among individual, any demanding situation or any threatening situation. If you have any kind of threat, for example, fear of mistake or different demands, fear of failure, that may lead towards stress. Types of stressors. Now there are two types of stressors. First one is external stressors, second one is internal stressor. We will study about what is meant by external stressor. External stressors are those events or those situations that happen to us in any kind of external environment. For example, मेजर लाइफ चेंजेस, आपकी लाइफ में कोई भी चेंजेस आते हैं in which we are unable to adjust, we are unable to adjust with a different kind of environment that is sometimes stressful for us, and different workplace, different expectations that may lead towards stress. Second type is internal stressor. Internal stressor may include unrealistic expectation that is totally and related to our own cognitions, our own thoughts. For example, sometimes we are having unrealistic expectations from society or other people. For example, parents or any person having expectations from you as well. If you are unable to cope or if you are unable to fulfill those expectations, that may lead towards stress. Second point is negative self-talk. Whenever we are unable to just fulfill those expectations or to achieve our goals, that may lead towards hopelessness. For example, in depression disorder, in anxiety disorder, the person may be involved in negative self-talk because of the low self-esteem, क्योंकि उनकी सेल्फ इस्टीम बहुत लो हो जाती है और वो होपलेसनेस और नेगेटिव सेल्फ टॉक की तरफ चले जाते हैं. Now there are different symptoms of stress. Different symptoms may involve disbelief, tension, difficulty making decision making. It is very difficult for them to take decision on their own. They are so much dependent on other because they do not want to take responsibility after facing failures in their life or any stressful situation. Loss of appetite, anger, mood swings, sadness, crying, sleep problems, headache, back pain, trouble concentrating on anything. So the psychological and the physical symptoms also rises because of different levels of stress. Signs and symptoms of stress are now classified into 4 categories: cognitive symptoms, emotional symptoms, physical symptoms, and behavioral symptoms. First one, cognitive symptom. Cognitive symptoms may include constant worriness about the situation. For example, if you have experienced any negative situation, that may cause constant worriness, that may cause overthinking thoughts, forgetfulness, inability to focus or to concentrate, poor judgment. They can means that they cannot take decision on their own. Second one, emotional symptoms. Emotional symptoms may include irritability, short-temperedness, aggression that may lead towards aggressiveness. Emotionally, the person becomes so much disturbed that may also lead toward different psychological and physical problems as well. But here, when we talk about emotional symptoms, we will talk about the psychological symptoms. For example, person having depression, having anxiety disorder. Behavioral symptoms may include aggression that are totally related to your behavior, in which the behavior is disturbed. That may include aggression, criminal behavior. That person may be included in criminal acts. Aggressive may lead towards aggression. They may harm other or may harm themselves as well. Drug addiction, self-harm, smoking, these are all included in behavioral symptoms. When a person is stressed, may lead towards behavioral disturbances as well. Physical symptoms may include insomnia, diarrhea, hypersomnia, excess of sleep. Insomnia means lack of sleep. Diarrhea, digestion problems, low energy. The person feels so much fatigued. Consequences of long-term stress: mental health problem, cardiovascular disease, obesity. Means if the person is facing the stress for longer period of time, that may lead to mental health problem, that may lead towards cardiovascular disease, cardiac problems, obesity. When person is in stressful situation, appetite may be disturbed. That may lead towards obesity as well in some situations, and eating disorder, bulimia, anorexia nervosa. So skin and hair problems as well, hair fall, skin problem because of stress. There are certain causes of stress. What are the different causes that may lead towards stress? That may include million of reasons, million of causes, but the important one are, for example, rejection from someone, not being accepted, marriage, retirement, marital disturbances, or any kind of disturbance in their mental life, retirement, divorce, chronic illnesses, or for example different type of diseases like cancer. Types of stress. Now there are different types of stress: acute stress, episodic acute stress, and chronic stress as well. What is meant by acute stress? Acute stress is there are different common types of stress, like it is very common. The causes may be negative thinking or domestic violence, right? Person having different negative thought pattern after facing different life situation, may lead towards negative thinking. Or sometimes if females, like they are having domestic violence, they are experiencing, that may also lead toward acute stress. Second type is episodic acute stress. Episodic acute stress occurs when acute stress happens frequently. When this level of acute stress that is just prolonged and frequently occurs, so the person may experience episodic acute stress. Person may become short-tempered, aggressive, irritability towards any kind of situation, pessimistic. Now pessimistic means if the person is having negative thought pattern, pessimism, expecting negative in every kind of life situation. Chronic stress. It lasts over long period of time. It can stem from such things such as chronic stress is such thing that last over longer period of time, and that may cause different disturbances, like the different factors that are involved in causing the chronic stress may include poverty, unhappy marriage, a bad job, contribute to serious diseases like heart disease, lung diseases, cancer, that may lead towards the chronic stress. How to manage stress? It is very important when we are studying about what are the different causes, what are the different reasons that lead towards stress. So it is also important to know that how to manage the stress. The goals of stress management is to identify things that cause problem or stress. For example, take care of yourself. Be present, be mentally present, be grateful, be thankful for what you have, because sometimes we are thinking about those things which we don't have and we become so much thankless. Avoid people who stress you. For example, avoiding stressors. Exercise regularly. It may uh, have very positive impact on your mind. Tips for the self care: avoid drugs and alcohol, drug addiction. Find support. You may find support, for example, social groups, your friends, your parents, any person with whom you feel comfortable. Connect socially, take care of yourself, eat healthy, well balanced diet, exercise regularly, get plenty of sleep that is required, because you feel so much stressed out. When you are stressed, you feel fatigued, and plenty of sleep is required. So give yourself a break if you feel stressed out. Maintain a normal routine. Accept your failures. This is also very important, and move on. Tips for self care: stay active, exercise, write, journal, writing on your diary, daily writing habits. Do something you enjoy, any game, any positive activity which you can engage yourself. Relax your body by exercising. Let your feelings out, focus on the present. This is very important, because if the person is stressed, maybe they are focusing on the past. In depression, such as, the patient may focus on the past experiences, and that may lead towards excessive worriness and hopelessness. So focus on the outside world as well. In the end, I would like to say that the greatest weapon against stress is our ability to choose one thought over another, because when you will choose the positive